ताको आपण क्लारिफाई करि परिबे एवं निजर बेसिक नॉलेज रखि परिबे जोडे कि आपण मानको मिली परुनी डायबिटीज कोन पई होउची डायबिटीज रे कोन खाइबा कोन खाइबानी डायबिटीज कोन सतरे रिवर्स करि परिबा डायबिटीज रो इंसुलिन फ्री हेई परिबा हो कि नाही ए सब विषय रे आपण नॉलेज पाई परिबे बुझि पारले सो आमर जो प्रोग्राम्स रो मुख्य मकसद थाए कि आपण को दैट बेसिक नॉलेज जोडा आपण माने जेतेले हॉस्पिटल जाउछंती आपण आम डॉक्टर्स मानक भितरे एवं आपण को मानक टाइम एते न थाए सो से टाइम गैप को फिल अप करिया पय आमे दिस प्रोग्राम को चलो सो दैट आपण को डाइट एज योर मेडिसिन्स फूड एज योर मेडिसिन्स ए विषय रे आमे बेसिक नॉलेज दे थाउ ठीक अछि सो आपण माने प्लीज मेक द नोट सो दैट इट्स वेरी इजी फॉर अस टू अंडरस्टैंड दैट आल्सो ठीक अछि yes ready with the notes so many people ready with the notes I am very happy for this note and please make the note जो जो टैक्स मु देवी आपन को से टैक्स आपन टिके फिल अप करिवे so it is very important for you okay so not an issue just make the notes if any doubts आपन माने मते लास्ट को भी पचारि परिवे and please make the note so that you can ask me the doubt last I'll share my screen it's a very important video for all of you also okay so don't miss this is a very important things for because आजिर सेशंस रे आमे जानिबा कोन कोन जानिबा ता ऊपर टिके नोट कर दियंतु प्रथम जिंस जानिबा व्हाट इज डायबिटीज डायबिटीज कोन डायबिटीज रिवर्सल रो मीनिंग कोन सेकंड आमे जानिबा कि काहे कि डायबिटीज रिवर्सल रो जरूरी होते एवं तापरे सम सक्सेस स्टोरी देखिबा एक्चुअली कोन सतरी डायबिटीज रे लोक भलो ही परछंती डायबिटीज रे मेडिसिन्स फ्री ही परछंती डायबिटीज रे इंसुलिन फ्री ही परछंती एवं ता संगे आमे डिस्कस करिबा कि मिथ्स कोन अछि इन डायबिटीज ओके एंड लास्ट को डिस्कस करिबा को प्रोटोकॉल्स थ्रू आमे रिवर्स करि परिबा तार बेसिक 1 to 2 प्रोटोकॉल आमे स्टार्ट करिबा काली इन द सेंस कि डे 2 रे आमे डाइट विषय रे डिस्कशन करिबा डाइट्स इन डायबिटीज कोन खाइबानी ऑल दिस थिंग एंड डे 3 रे आमे डिस्कस करिबा नॉट ओनली डाइट आउ कोन कोन प्रोटोकॉल अछि ताकू नै कि हमें डायबिटीज को रिवर्स करि परिबा ओके सो इन टोटल हमर प्रोग्राम्स बेसिक दिस इज द बेसिक डायबिटीज रिवर्सल प्रोग्राम 3 days program okay in 3 days all this thing will cover okay so welcome to day 1 and please ready with your notes pen and paper आपण नोट्स जदि रखिबेनी किछि लिखिबेनी किछि फायदा नै ओके जदि आपण किछि बुझियो चेष्टा करिवे आमे कोन पे ये प्रोग्राम्स करूची माउथ रे कहि दोची आपन को when you go to any hospitals any doctors they will give you time for how many minutes 5 minutes 10 minutes maximum maximum half an hour right and सेठी कोन होची आपन को डाइट्स एंड लाइफस्टाइल विषय किछि एजुकेशन मिलुनी जोथि पई कि कोन होची योर
अच्छा
मेडिसिन्स नंबर्स 1 2 3 4 5 all these medications will go on and people are no knowledge on this side effect of these medicines and jodi long term maybe kon asubidha hebo even I have seen a lot of people taking insulin also matlab 1 2 3 so many doses insulin nala pore tankar body kete toxic he jaye overweight he janti tankar peto bodi jaye tankar body re fat deposit he jaye because they have no knowledge on that ke semane bahut more to sugar normal achi even after reversal challenge. ଆମେ ଆଗରୁ ୟାକୁ 5 days କରୁଥିଲୁ but we make it 3 days because of time constraint and all these things. So yes, these are basic rules and regulations. It's a very actionable workshop. ଆପଣଙ୍କୁ ଯୋଉ ଟାସ୍କ ଦିଆହବ ଆପଣଙ୍କୁ ଯୋଉ you know ଜିନିଷ କୁହାହବ ଆପଣ ଟିକେ ଫଲୋ ଯଦି କରିବେ you can get the result very soon, no doubt of that. Okay, chalo. Then second thing is that be ready with your notes, pen and paper. Yes, this is a very important thing. Notes, pen and paper is very important thing. Otherwise, you cannot understand all these things. Okay, so be ready with your notes, pen and paper. Okay. If any questions arise, you can ask in the comment box during the live class also, or at the end of the meeting, you can clear that doubt. Okay. So last good task with you have, you need to clear that task also. This is my basic qualifications before going to this kind of meetings, because people cannot believe people are now following any videos in the YouTube, so many videos in the YouTube. Okay, and they are following some abnormal things also, and they are believing that this is very good for me, and this is the problem also now. ସେଥିପାଇଁ ଆପଣଙ୍କ ପାଇଁ ଏଇ programs first time in the Odisha, we have bring a lot of success. Now ଏବେ କଣ ହଉଛି, we have a camp program also, ଯୋଉଠି କି patient ଆସିକି we can stop their insulin within 1 to 2 days also, right? Lot of success stories you can see, right? So this is my basic qualification. ମୋର MBBS Bhimsar Medical College ବୁର୍ଲାରୁ ହେଇଥିଲା. ମୋର post graduation is from the MKCG Medical College Berhampur. Now working as assistant professor in SRM Medical College also. And after researching a lot of books on natural healing systems and this rule of diets and how to reverse that, rule of I have so many mentors actually, on this particular things. So ତାଙ୍କଠୁ ବହୁତ କିଛି ଶିଖିଛି, and ଶିଖିଲା ପରେ ଏଇ ଜିନିଷକୁ ମୁଁ apply କରୁଛି, ଯୋଉଟା କି ଆପଣଙ୍କୁ ଟିକେ ନୂଆ ଲାଗିପାରେ, but this is the truth. And author of this course also, I'm author of this diabetes reversal mastery course, and we have a lot of participants in that course. And if you want, you can also join at the end also. Okay, but this is a basic 3 days program. You should not miss this. Okay, chalo. So what is the meaning of reversal? Reversal or basic meaning ଆପଣଙ୍କୁ କହିଦଉଛି, going in opposite direction. Okay, suppose ଆପଣ ଗାଡି ଚଲାଉଛନ୍ତି, you go to the hill station, right? Off and off. You need to reverse it, reverse gear of the gadi, right? So you need to go to back. Okay, so suppose if you are taking insulin medicines, the amount of and doses of that going off and off gradually coming ଯିବ. Okay, and ଆପଣଙ୍କ ଦେଖିବେ ସୁଗର ଲେଭେଲ ବି ନର୍ମାଲ ହେଇଯିବ, କିଛି ଦିନ ପରେ ମେଡିସିନ୍ସ ବି ଷ୍ଟପ୍ ହେଇଯିବ, ଇନସୁଲିନ ବି ଷ୍ଟପ୍ ହେଇଯିବ, and you normalize your blood glucose, blood pressure readings also. You're free from the any complications of diabetes. Remember, diabetes, write in your notes also. Diabetes is a silent killer. Diabetes is a silent killer. Just write in your notes. Why I am called it silent killer? ଆପଣଙ୍କର ଯୋଉ ବ୍ଲଡ ଗ୍ଲୁକୋଜ ସ୍ପାଇକ୍ ହେଇକି ରହୁଛି, ଇନସୁଲିନ ରେଜିଷ୍ଟାନ୍ସ ରହୁଛି, ଆପଣଙ୍କର ଡିଫରେଣ୍ଟ ଭିସରାଲ ଅର୍ଗାନ୍ସ ରେ ଫ୍ୟାଟ କୁ ଡିପୋଜିଟ କରିଥାଏ. Yes, I have seen a lot of cases. ଫ୍ୟାଟ କୁ ଡିପୋଜିଟ କରିଥାଏ. Okay, suppose I am giving one example. You are taking insulin, right? Those who are taking insulin, just type I in the chat box. Those who are taking insulin, just type I in the chat box. Okay, I want to check how many of people are taking that. Okay, so what it do? It first take out the glucose from your blood. Okay, ଆପଣଙ୍କ blood ରୁ ସିନା glucose କମିଯିବ, but that will get deposited and in different parts of the body when insulin resistance develop. And sometimes ଆମେ ଦେଖିଛୁ ତାଙ୍କର ଓଜନ ବଢି ଯିବ, sometimes ଆମେ ଦେଖିଛୁ ତାଙ୍କର ପେଟ ବଢି ଯିବ, ମୁହଁ ଫୁଲିଯିବ, ଗୋଡ ଫୁଲିଯିବ, fatty liver ହେବାର ବେଶୀ chances ଥାଏ, like that. So in reversal, what we do, we gradually taper that insulin doses, medicines doses as per their reports also. Okay, so they free from the diabetes complications also. जो complication तांको हेबार थिला ସେମାନେ free ହେଇପାରିବେ. they will also weight loss ହେଇଯିବ ତାଙ୍କର, they will also look younger and become fit. Okay? Those who uh, those who get understand this reversal, just type RRR in the chat box. Just type RRR, reversal in the chat box. Okay. It's also called remission nowadays, you know. Reversal means complete extermination of the disease, cure. But remission means partial. Partial reversal is called remission. Yes. It is Sri Mohanty, madam. Thank you so much, Nima. Yeah. So thanks a lot, those who are typing. Because reversal meaning upon bujile next step ko upon jaipari, what to do for that. Okay. Let me show you some of the things, what is called some examples, right? See, this is the success story, you know. His name is Mr. Bhavani Prasad Patnaik. He joined my program and his weight was 86 kg, but now 70 kilo. He was taking 8 tablets and now no tablet he was taking. No any tablet. Yes. This is the result after 3 months. Okay. You can see his abdomen size, but now the abdomen size is reduced. Okay. Yes. You can see swelling of the face, but now face is not swelled. You can see the double chin feature. Just double chin feature, mota hijaar, mota facial look. It will change to like this transformation. You can see HbA1c that is 13%. This is the gold standard test को आ जाता है HbA1c को. And it is 6% now. PPBS 210, but now 120 now. Okay. You can see the fasting blood sugar 280, but now it is 99 without medicines. Before he was taking 8 medication. 8টা medicine खाउतले. Along with he was also blood pressure. But people cannot believe that blood pressure also reverse. Okay. But in my program, hundreds of patients already also stopped their medication with my guidance, proper guidance, right? So these are some, not only one story. I'll see you a lot of success story, okay? Not only one story, you know. When you go to, yeah, so many people are typing reversal RRR. This is the meaning of actual reversal, okay, friends? Yeah, and this is possible because of their understanding. ମୁଁ ଯାହା କହୁଛି ତମକୁ ସେମାନେ ବୁଝୁଛନ୍ତି ତାଙ୍କ notes ଆପଣ ଦେଖିବେ they will make notes like my medical students. I teach in a medical college to my medical students and they all make their notes very clear. Okay. I make all the points very concise. Meaning of reversal. All you type RRR. Thanks a lot. Like this. Then some examples show କରିବେ ଆପଣଙ୍କୁ. Then some proofs, some beliefs ଆସିବ ଆପଣଙ୍କର. Then ଆପଣ step by step plan କରିବା. Okay. So when you go to my YouTube channel, you so many lot of other videos also. When you go to my YouTube channel, not only one video, you can see a lot of video, you know. This is my YouTube channel, right? Yeah. You can go to my YouTube channel, just type Dr. Madhav in the YouTube channel. I'll share you the link also. Okay. I'll share you the link also. But when you just go to YouTube channel and type my name also, you know, just type Dr. Madhav, THAB and NAYAK diabetes, DIABETES. Just you type like this also. You'll get a lot of videos of mine. You know. See, this is a live video going on, and you can see in the YouTube also. Okay. Yeah, and so many news channel come. This is the Argus news channel, you know, Argus News, and so many other news channel. You can see this video. And this is one of my programs video where I taking my classes to my patients. This is practical classes, you know. 42,000 view of this video, you know. So many videos. This is my direct protocols video, my plant proteins and animal, everything I have explained very clear. People are asking, show me the videos of your life, how to start all these things. So this is all these things. This is my camp programs details also you can see, you know. So when you go to my channel, you click that channel. Okay. When you click that channel, if you want, upon this चाहूँचंती members हेवा पाई, upon join that, and you can also be a member of our channels so that you can watch others video also, you know. That means someone unlisted video जो मैंने members होंगे तांको membership मिल जाए थ्रू join करी परिवे आपण याको नेकी भी not an issue, but you can go to other video also. You can see the video section. Okay. So how the people have reversed their diabetes, how they are a success story, So many success story in my programs. They have come, they have joined and see their result. I have give all these things practical seasonality. Okay. That's why in my program, you cannot believe in this thing indirectly. That's why I show all these proofs to you, how they have reversed and all these things. So you can also see this thing. Just type in the YouTube Dr. Madhab Nayak diabetes, and you can also see a lot of video. Okay, you can see, yeah, there is an N actually, but it will guide you. Okay, diabetes. Yeah. So when you see this thing, you can know it. Yes, this is possible. And how to possible? This is a step by step guidance, right? I'll give this guidance to all of you, and you can see a success story of more than 500 patients in my YouTube channel also. Okay, so this is for your belief purpose. I am showing it to you. Okay. Next, I jump to my program. Okay. So let us jump to what to do for next. Okay. So that's why I do step by step things. So many patients, this is a one of patient Guru Prasad Dura. He was 97 kilo, but now 82 kilo, not 92. He was also taking around 8 medicines. He was on insulin out 10 unit, but now not taking any insulin. Okay. So however, man, a lot of people of this transformation you can see, not only one patient. I am showing all these reports before, afters, and all these things. So, are you ready to check this challenge? Just type yes in the chat box. This is challenge for you, Challenge in the sense ki you can able to tell your what? You can able to tell your friends, relatives, colleagues. I can also able to reverse my diabetes. So if you're ready, just ready in the chat box so that we can start the class session very soon. Okay, what is diabetes, what are the types of diabetes, and all these things. Because basic ଆପଣଙ୍କୁ ବୁଝିବାର ଅଛି କୋଉ type reverse ହେଇପାରିବ କୋଉ type reverse ହେଇପାରିବନି everything is I'll clear. Just type is my slide is visible, yes or no? Is my slide is visible, yes or no? Yes. Chalo. Very good. Visible. Okay, those are ready. Just thank you so much. It is Srimanti Bipin Patti sir. Ready? Very good. Chalo. Without any delay, start noting down the points ଯୋଉଟା ମୁଁ କହୁଛି ଆପଣଙ୍କୁ because ଆପଣ ଟିକେ basic ବୁଝିବା କୋଉ diabetes reverse ହେଇପାରିବ କୋଉଟା ହେଇପାରିବନି everything I'll tell you in my program. Okay. Very good. Chalo. This is challenge for you. Thanks for typing yes. And this purpose is to very simple because you have no time now for your health. ସେଥିପାଇଁ ଆମେ କଣ କରୁଛୁ ଆମର ସିମ୍ପଲ ୱେରେ ଦିସ୍ ମେଡିକାଲ ସାଇନ୍ସକୁ ଆମେ ଆପଣଙ୍କ ପାଖକୁ ପହଞ୍ଚାଇବାକୁ ଚେଷ୍ଟା କରୁଛୁ to reverse this kind of chronic disease like diabetes, blood pressure, gastric problem, obesity, thyroid problem, Alzheimer's disease, high cholesterol, high triglyceride, all this kind of lifestyle disease, it's because of sugar. Yeah, it's because of sugar, it's because of diabetes. So this is what my purpose to empower you and those who ready for empower of all these things to grasp this knowledge because जब तक ଆପଣ ଏଇ knowledge को grasp କରିବେନି only medicines ପଛରେ ଧାଇବେ this meeting is not for that people. Okay, my mission is this thing to empower that people ଯୋଉମାନେ ଏ ବିଷୟରେ knowledge କିଛି ରଖି ନାହାନ୍ତି. And with this empowerment technique I got that thousands of results what I've shown just before you. So in that thing, who can attend this program? Before it was 5 days actually, but now it is 3 days. Who can attend this program and pre-diabetes, diabetes patient, those who are taking medicines or insulin, PCOD, blood pressure, all these things patient. ठीक ଅଛି? So I'm just going to topic proper key. What is diabetes and where we need to? Yeah, there are some lies also, but we discuss the lies later. So yes, come now. So there are some myths versus facts in diabetes. Let's dive in the chat box. The 5 biggest lies on type 2 diabetes. Okay. Let's dive in your notes. Okay. Because lies is very important. ଆପଣଙ୍କ mind say confusion ଏବେ ବି ଅଛି lies. If you not clear that lies, that causes problem. You cannot reverse diabetes. Okay. So just type the 5 biggest lies on type 2 diabetes. Okay. So first lie is once you have diabetes, you must need to take medicines for lifetime. Okay, this is the lies. But I'll just show you that patient जो मैंने already reverse करी सारिଛନ୍ତି जो मैंने so many patient have reversed it. So this is the lies. This is the truth is you can also have a medicines free life. You can also have a insulin free life. Yes. ଯେମିତି previous patient ମାନଙ୍କର ଦେଖେଇଲି ଆପଣଙ୍କୁ Okay. Second lies ବହୁତ ଲୋକ ଆପଣ ଜାଣିଥିବେ once you have diabetes you cannot eat coconut, you cannot eat ghee, mutton and all these things. ମାଛ ମାଂସ ନା କିଛି ଖାଇବେନି ବୋଲି ମନା କରାଯାଏ ଆପଣଙ୍କୁ. It's a wrong science, actually, old science. But now, new science already evinced, and that tell you can also able to tell that eat that. Okay. So how to take that and all these things ମୁଁ ସେ ବିଷୟରେ ଆପଣଙ୍କୁ ଜଣାଇବି. Okay. Lies number 3. If your parents are diabetic, you always become a diabetic. ଏମିତି କୁହାହେଇଥିବ. Parents are diabetic ଯଦି ହେଲେ ଆପଣଙ୍କୁ ସବୁବେଳେ diabetes ହବ ବୋଲି କୁହାହେଇଥିବ. But this is also not true because in reality, you can have a very diabetes free life, even your parents have diabetes, because the genetic role is only 15 to 20%. Rest other percentage is your lifestyle or your diet, environmental factors. Okay. You must follow a very strict diet plan. But remember, my friends, it's not very strict, but understanding the diet, understanding the EGL principle, estimated glycemic load कौन କୋଉ diet ନେବେ କେମିତି diet ର estimated glycemic load କମ କରିବେ okay which is good for you all this knowledge is very important okay so that's why it is called program where we give the guidance is a coaching program of we will coach you okay and the truth is that you can have a very flexible and variety of foods to eat just meeting start କରିବା ଆଗରୁ ଯେମିତି ଆମର ନିର୍ଭୟ ବାବୁ ଆମର 1 year program join କରିଛନ୍ତି ସେ ଯେମିତି ଆପଣଙ୍କୁ ଜଣେଇଲେ you can also able to stop that yeah so type 2 diabetes can be never be fast what is the meaning of that intermittent fasting right but remember my friends in reality the intermittent fasting shows a very miraculous results in type 2 diabetes and that's what I guide you okay but this is the problem statement now so many people in India now more than 101 million people have diabetes. 101 million people have diabetes. And the number is going on increasing day by day. Why? Because people have no knowledge on reversal, right? Because they are not reversing their diabetes. That's why the medicines number, dosing, and all these things gradually increasing day by day. Okay, friends? So, ଆମେ ସେଥିପାଇଁ ଆପଣଙ୍କୁ reversal knowledge को प्रथमे focus करता हूँ. So that upon once you have got this knowledge, then you can also clear your doubt also, right? Okay. And this is the problem, This is the ICMR studies, Indian Council of Medical Research. More than 101 million people have diabetes by India today. So, କହିବାର ମାନେ ହଉଛି କ'ଣ କି because ଆମେ once ରୋଗ detect ହେଲା ପରେ ଆମେ ତାକୁ reverse କରୁନୁ ଆମେ ତାକୁ ବଢେଇ ବଢେଇ ଚାଲିଛୁ 1 2 3 4 like that because we have no knowledge on this thing and this is the problem now okay so but remember 1 in 11 diabetes 11 adults has diabetes adult onset diabetes 1 in 11 ମାନେ ଦେଖନ୍ତୁ 11 ଜଣରୁ ଜଣକୁ diabetes ହେବେ so problem is that people have no knowledge on this reversal that's why the number is increasing this is the prevalence of diabetes ଆପଣ ଦେଖନ୍ତୁ କେମିତି ବଢି ବଢି ଚାଲିଛି world wide prevalence okay 2005 ରେ କେତେ କମ ଥିଲା 2040 expected ଦେଖନ୍ତୁ ଆପଣ 642 okay millions expect କରାହଉଛି so many number so ପଳେଇବା basic knowledge କୁ what is diabetes ଆପଣ ସମସ୍ତେ ଜାଣିଛନ୍ତି blood sugar ବଢିବାଟାକୁ diabetes କୁହାଯାଏ but ମନେ ରଖନ୍ତୁ ଯୋଉ ବ୍ଲଡ ସୁଗର ବଢୁଛି କଣ ପାଇଁ ବଢୁଛି ଆଇଦର ଆପଣଙ୍କର ଇନସୁଲିନ ହରମୋନ ପ୍ରଡକ୍ସନ କମି ଯାଇଛି or ଆପଣଙ୍କ ଶରୀରରେ ଇନସୁଲିନ ହରମୋନ କାମ କରୁନାହିଁ basing upon these two things we guide you that which kind of diabetes you have okay basing upon these two things we guide you which kind of diabetes you have either type 1 or you have type 2 like that okay so ଆମର मेन पर्पस थाए कोन कि आपन को बेसिक नॉलेज दे देला परे हमें तापर गाइडेंस दे थाओ सो listen to this basic knowledge then we also guide you properly also for that okay yes so diabetes reversal yes diabetes रो actual meaning होची कि blood sugar आपन को blood level normal glucose to बढ़ी जिपो and suppose I just giving you example fasting blood sugar आपनकर जदि more than 126 लेखिके रखंतु just write in your notes if the fasting blood sugar खाली पेट रो sugar more than 126 is called diabetes 126 is called diabetes second if your pp blood sugar खाई सारला blood sugar after 2 hours of food if it is more than 200 is called diabetes okay or rbs random blood sugar if it is more than 200 is called diabetes your HbA1c that's called glycosylated hemoglobin HbA1c level if it is more than HbA1c level is more than 6.5 6.5 is called diabetes write the points 3 points mu कहली एबे आपन को कोन कहली yeah very good first point fasting blood sugar more than 126 is called diabetes very good yes second your red खाई सारला पर sugar random blood sugar यदि more than 200 is called diabetes yes then third point मु आपन को आगुटे कहली HbA1c that is called glycosylated hemoglobin okay glycosylated hemoglobin yes very good if it is more than what 6.5 is called diabetes very good okay yes then आमे डायबिटीज को डिटेक्ट करिया पे आउ किछि टेस्ट होछि कि लोक कोन करंती सेही टेस्टिंग किछि करि न थांती राइट मु सेही विषय रे भी आपन को टिके जणै देबी what test should be done and what test should not be done because एबे बहुत प्रोटोकॉल चेंज हो गलानी आपन केबे प्रोफाइल टेस्ट करू नथिले नो वी हैव सो मेनी प्रोफाइल टेस्ट ऑन दैट प्रोफाइल टेस्ट रो मीनिंग कोन हमें कहितौ जो टेस्ट रे हमें जानि देबा कि आपनकर आउ कोन कोन प्रॉब्लम्स अछि okay so just I'll show that some testings also मु आपन को देखे देबी आपन केबे फास्टिंग इंसुलिन विषय जानि नाहंती आपण इंसुलिन रेजिस्टेंस कोन जानि से विषय रे भी हमें टिके चर्चा करिबा हमर प्रोग्राम्स डिटेल्स रे एंड बिकॉज जब तक बेसिक नॉलेज न हो आपण जानि परिबेनी सो let me show that things to you okay quiz yes okay chalo so diabetes kon hoye apne jere only medicines upare depend करती your the medicines number increasing day by day and that causes problem and the practice guidelines are all focused on this drug management not on reducing the medications no any practicing guidelines now form to taper your medicines but this is the problem now that's why आपन medicines tapering केबे होनी okay so tapering को हमें focus करता हूं in my programs just go to basic anatomy कि yes this is the your liver okay this is your liver एडा होचे आपन को liver this is the abdomen and this part is called pancreas you can see that okay yellow part pancreas is in odia it is called agnasya odia रे कोन को जाय को very good agnasya को जाय okay it's called agnasya okay agnasya in odia it is called agnasya okay chalo very good very good in odia it is called agnasya okay so chalo just you want just a minute I'll just show you one thing ha in odia it is called agnasya okay so एथिरे कोन हुए इंसुलिन प्रोडक्शन हेई थाए एटा होची आपनकर डिफरेंट पार्ट्स ऑफ द पैनक्रियास यू कैन सी दैट थिंग्स ओके एंड ग्रेजुअली कोन हुए तारो हम यदि हिस्टोलॉजी नबा ना बेसिक एनाटॉमी दैट कंटेंट बीटा सेल गोटे देखंतो आपनकर बीटा सेल जोटू इंसुलिन प्रोडक्शन हेई थाए yes remember my friend this is a beta cell and where the insulin is produced इंसुलिन हार्मोन बीटा सेल रु प्रोड्यूस होता है मन रखंतु या एवं जो इंसुलिन हार्मोन प्रोडक्शन होता है दैट्स ए वेरी इंपोर्टेंट हार्मोन्स टू नो एंड टू योर पर्टिकुलरली कौन आपनकर कंडीशन जानिया पई आपनकर पर्टिकुलरली यस जस्ट अ मिनट ओके सो केते इंसुलिन प्रोडक्शन होची इंसुलिन प्रोडक्शन रो क्वांटिटी केते जदि आमे देखितो बहुत केस रे टाइप 2 डायबिटीज केस रे इंसुलिन प्रोडक्शन सफिशिएंट होथाय किंतु बीटा सेल्स काम करनथाय से केस रे बीटा सेल माने माने सेंसिटिविटी कमी जाइथे से केस रे देखो रेजिस्टेंस बोली कुहा जाय ता विषय रे गोटे रिपोर्ट मु आपन को देखौची जस्ट हाउ टू नो दैट ओके जस्ट आई एम शोइंग यू वन रिपोर्ट्स ओके को टेस्ट आमे करतो से विषय जनकर रिपोर्ट आपन को देखौची जस्ट आई एम शेयरिंग द रिपोर्ट्स. See, this is a one report, so we advise our patient to show their HOMA IR test. कई करंतनी, but we practice to do in my programs. जो थे आपनका बीटा सेल केते परसेंट काम करछथि. Anybody has tested that things? Just type in the chat box. जो माने टेस्टिंग करछथि बीटा सेल केते काम करछि. Nobody? Okay. चलो. Yeah. सो ए जे जो बुझेली आपनको पानक्रियास थाई पानक्रियास रे गोटे बीटा सेल अछि बीटा सेल जदि ठीक से काम कर नथिबो ताहले भी डायबिटीज हेबो एवं आपनको इंसुलिन जदि बाहरुछि एवं इंसुलिन काम करनी ताहले भी डायबिटीज हेबो राइट सी पीपल या भीतर डिफरेंस जानि पारंतिनी जस्ट लेट मी शो यू वन रिपोर्ट ओके okay so I hope you can see this HOMA IR2 report see this is the report you know होमा आईआर टू केमती एक्सप्लेन करा है देखंतु आपण देखंतु गोटे पेशेंट कर मु रिपोर्ट आपन को देखौछि यू कैन जस्ट सी दिस थिंग ग्लूकोज देखंतु एथरे कोन ग्लूकोज फास्टिंग अछि 127 इंसुलिन फास्टिंग अछि 6.5 16.5 बीटा सेल फंक्शंस अछि 82% दैट शुड बी मोर देन 100 आपन लिखि रखतु normal beta cell function should be more than 100% okay but तांको केस रे 82% अछि देखतु but insulin sensitivity 43% insulin sensitivity 43% that should be more than 100% so it is typical case of type 2 diabetes बुझी पाले anybody had done this test just type I in the chat box anybody have done this test just type I in the chat box because I'll also advise how to do this test okay अपन केमती test करी परिबे how to do this test I also give you the number for that test no need to worry okay so because ଆମେ ପ୍ରଥମେ କିଛିଟା डायग्नोस्टिक ଭ୍ୟାଲୁ କୁ ଯାଇଥାଉ ତାଙ୍କର ଆପଣଙ୍କ एक्चुअली मेडिसिन ନେଇ ନେଇ ଆପଣଙ୍କ ବିଟା ସେଲ କାମ କରୁଛି ନା ନାହିଁ ଯଦି କାମ କରୁଛି କେତେ କାମ କରୁଛି एंड तार हिसाब रे आमे आपनकर डाइट टाକୁ मॉडिफाई करथौ यस ओके सो these are basic things for your understanding okay then I jump to the yeah, how to do this test and all this thing I'll jump to that also what is the name of this test okay just a minute ମୁଁ ଆପଣଙ୍କୁ show କରିଦେବି not issue for that and because basic testing रे जणा पड़िबो आपनको बीटा सेल केते काम होई बहुत लोक जानि ना था ए टेस्ट विषय ସେଥିପାଇଁ ସେମାନେ ଲାଷ୍ଟ କୁ ପ୍ରୋବ୍ଲେମ ରେ ପଡି ଯାଆନ୍ତି ଓକେ ସୋ दैट्स व्हाई आई ट्राई टू शो दैट टेस्ट टू विथ यू आल्सो ओके this is called diref advanced package just write in your notes this is called diref advanced package test diref in the sense ki diabetes reversal package test yes okay so let me show that image to you okay yeah those who want this test you can also do that अपन भी करि परिबे and different district रे भी आम एई सेंटर अछि आपण ताको जस्ट मु देखे दोचे आपण को you can also have this knowledge on this test this is called direct advanced package test okay can you able to see my slide just type yes in the chat box can you able to see my slide my screen okay so this is called direct advanced package test Yes, thank you. If you do it outside, it will cost around more than 8,000 cost पड़िबो, but एते costly नुहो एटा. आपण दी एथरे कोन आछे आपनकर विटामिन 102 टेस्ट आछे, विटामिन प्रोफाइल, विटामिन डी, विटामिन B12, डायबिटीज प्रोफाइल आस्ताय, आपनकर थायराइड प्रोफाइल, लिपिड प्रोफाइल, लिवर प्रोफाइल, किडनी प्रोफाइल and HOMA IR analysis, all these things. So आपण कहबे सर ए टेस्ट सब करिया कोन दरकार? Yes. कोन पय देखंतु डायबिटीज रे मल्टीपल ऑर्गन्स रो कॉम्प्लिकेशन को धरते थाय बेले बेले. So we need to rule out that also. आपनकर kidney complications, liver complications and nutritional deficiency, all these things. So you just note down this number, okay? तले गोटे number दिया है, you can see this number, yes or no देखंतु. You can type the number 858. Just a minute, number आपनो show हो न थिबो. I'll share this thing in the group. Yes. 858 590 8864. Okay. Just type the number, those who are watching my video, so that आपण भी से नंबर को कॉल करके आपण को डिस्ट्रिक्ट रे कोठी हबो एंड ऑल दिस थिंग विषय बुझी पारिबे. ओके. आउथरे. ओके. Just typing the number 85 90 8864. Okay, this is one number. Another number हम आपन को शो कर दो मोर स्क्रीन रे, जोटा कॉल करके आपण भी एई प्रोफाइल टेस्टिंग करि परिबे. Just a minute, I'll present that thing to you also, because this test is very important to know the your progression status. Okay. आपण को स्टेज रे अछंती डायबिटीज रो, रिवर्सल बीटा सेल केते काम होची, ए जो पर्टिकुलर बीटा सेल अछि, एवं ए विषय मु आपन को डिटेल्स जणाई था, बिकॉज़ वी ऑल नीड टू नो दिस थिंग आल्सो, यू नो. The number is 78944. आ गुटे नंबर 78944 06450 06450 78944 06450. Just a minute, मैं आपको expand कर दूँगी so that you can also see these things. Okay. Okay. Is this number visible? आपको number देखा जाउची कि नहीं? Yes or no? देखा जाउची yes लिखंतु, because save this number for the testing. आपण दी any place रे ओडिसा रे चाहुचंदी, you can do this testing. Okay. देखा जाउची 78944 06450. Yeah. भुवनेश्वर भी होची, भुवनेश्वर रे आपण कॉल करी परिबे. ओके. ओके, यस, विजिबल. सो दैट आपण कोन हम कोन जणा पड़ता है. यस, इट इज टोल फ्री नंबर आल्सो. आपण ए नंबर को सेव कर दियो, तो ए नंबर रे बेटर जदी सेतरे किछि प्रॉब्लम हेले ए नंबर रे आपण कॉल करे इमीडिएट रेस्पॉन्स पाई परिबे. आपण आपनकर प्रोफाइल टेस्टिंग को देखि कि हमें कोन करथाउ, we progress according to the reversal as per your and diet according to that also. I mean diet को सही हिसाब रे भी modify करता हूँ, because everybody's body is not same, right? I'll show you another some reports also, जो थरे आपण देखिबे अन्य लोक मानकर केमती प्रोफाइल टेस्ट वेरी करता है, because समस्त रिपोर्ट सेम न था, right? And according to that we vary with our protocol and our program also. So basic program रे हमें किछटा टेस्टिंग भी करता हूँ, आपनकर प्रोफाइल टेस्टिंग. And according to test, हम बेले CGM भी सम पार्टिसिपेंट को इंस्टॉल करता हूँ, बट CGM समस्त को दरकार पड़ेनी. CGM माने कंटिन्यूअस ग्लूकोज मॉनिटर गुटे अछि. Yes. No, so not to all, because some participants need that, some participants may not need that. Okay. Okay. So yes. I am following the DIP diet last 4 years, but my HbA1 6.3. What is DIP diet? Can you explain, Sasikant Panda, what is DIP diet? What is the full form of that? Is there any standard diet called DIP like that? Not like that, right? Okay. So many people are, false, they're following any false diet, they have no any scientific background. Okay. This is the problem. They cannot reverse their disease and finally they suffer with the problem. Okay. Yes. So that's why more. Okay. ଆପଣଙ୍କ ପାଇଁ personalized diet ହେବ. It is your diet, not any other's diet. Okay. It is your diet as per your reports. This is called personalized diet. ଆପଣ ଲିଖି ରଖନ୍ତୁ. Yeah, this is called personalized diet. ଆପଣଙ୍କ diet, yes. ଆପଣଙ୍କ ମାନେ ଆପଣଙ୍କ reports କୁ ନେଇକି ଯୋଉ diet ଆମେ ତିଆରି କରୁ. And no such kind of diets like what I'm telling ki DIP diet, VIP diet. What is that here? All nonsense diet. Okay, so all you need to follow the diet according to your profile. Okay, what we advise to our participant also, and in my programs, because all you know need to know, because ଆପଣଙ୍କର ଯଦି ବିଟା ସେଲ୍ କାମ କରୁନଥିବ କୋଉ ଡାଏଟ୍ ଆପଣଙ୍କୁ ସେଇ ବିଟା ସେଲ୍ କୁ କେମିତି କାମ କରିବ ସେଇ ଡାଏଟ୍ କୁ ଆମେ କହିବୁ ନା ଆପଣଙ୍କୁ। ସୋ ଆମର ପର୍ପୋଜ ହିଁ ସେଟା ଥାଏ କି we advise you as per your basic reports. That's why we do some kind of testings also for that. And according to testings, we know co-condition रे आपन को pancreas अच्छी and all these things, right? Yes. Just I'm showing some reports with you. Yes. Yeah. Suppose I just show ଗୋଟେ report ଆପଣଙ୍କୁ show କରୁଛି ୟାଙ୍କର ବିଟା ସେଲ୍ କେତେ କାମ କରୁଛି। ଯୋଉମାନେ କରିଥିବେ ସେମାନେ ଜାଣିଦେବେ ଦେଖିବେ। ଏଇ ଟେଷ୍ଟରେ ଆମେ ଦେଖିପାରିବା ଆପଣଙ୍କ ବିଟା ସେଲ୍ କେତେ କାମ କରୁଛି ଦେଖନ୍ତୁ। ବିଟା ସେଲ୍ ଫଙ୍କସନ୍ସ 82%, ମାନେ କଣ ଭଲ କାମ କରୁ ଚଳିବ। ତାକୁ 100 ଉପରେ ଆମେ କ୍ରସ୍ କରିଦେବୁ ଆମର ପ୍ରୋଗ୍ରାମ୍ସରେ ୱିଦାଉଟ୍ ମେଡିକେସନ ଅଲସୋ। ଇନସୁଲିନ ସେନ୍ସିଟିଭିଟି କେତେ ଅଛି? ଦ୍ୟାଟ୍ ମିନ୍ସ ଦ ଅପୋଜିଟ୍ ଇଜ ରେଜିଷ୍ଟେନ୍ସ। ୟାଙ୍କର 43% ଅଛି। That should be more than 100% sensitivity, right? Yeah. So resistance ଅଛି ଏ କେସରେ around 67% resistant ଅଛି ଏ କେସରେ, right? So ଆମେ କହିବା ଏଟାକୁ ଇନସୁଲିନ ରେଜିଷ୍ଟାନ୍ସ ଡାଇବେଟିସ୍ or type 2 ଡାଇବେଟିସ୍ ବୋଲି କୁହାଯାଏ। ଲୋକ ନିଜର ଟାଇପ ଅଫ ଡାଇବେଟିସ୍ ବିଷୟରେ ଜାଣିନଥାଏ ତାଙ୍କୁ, ରାଇଟ୍? ସୋ ଆମେ ତାଙ୍କୁ ତାଙ୍କର ଟାଇପ ଅଫ ଡାଇବେଟିସ୍ ବିଷୟରେ ଜଣାଇଥାଉ। Not only one test, you can see other test also, my friends. ভিটামিন ডি লেভেল দেখନ୍ତୁ କେତେ ଲୋ ଅଛି ଏ ପେସେଣ୍ଟର। ଭିଟାମିନ ଡି ଭିଟାମିନ B12 ଦେଖନ୍ତୁ 188, ଭେରି ଭେରି ଲୋ। ଓକେ, ଦିସ୍ ଦ ପ୍ରୋବ୍ଲେମ। ଭିଟାମିନ B12 କମିଲେ so many complication will come. ଭିଟାମିନ ଡି ଦେଖନ୍ତୁ only 24, it's very very low. ଏଥିପାଇଁ ଆମେ କଣ କରିଥାଉ ତାଙ୍କର ଲେଭେଲକୁ ଦେଖିକି ଆମେ ଆମର ଡାଏଟକୁ ଚେଞ୍ଜ କରିଥାଉ ମାଇ ଫ୍ରେଣ୍ଡସ୍। ୟେସ୍। ୟା ସି ପେପ୍ଟାଇଡ୍ ଲେଭେଲ ମାନେ କଣ ଆପଣଙ୍କ ପାନକ୍ରିଆସ ସତରେ କଣ କାମ କରୁଛି? ୟେସ୍। କେତେ କାମ କରୁଛି ଜାଣିବା ପାଇଁ। ଓକେ, so many HbA1c ବି ପଳେଇ ଆସିବ ସେଥିରେ, OMAR ପଳେଇ ଆସିବ ଆପଣଙ୍କର, microalbumin ପଳେଇ ଆସିବ, lots of good things will find, and according to that we'll prepare the diet. If the vitamin D is low, we'll prescribe a diet high in vitamin D. Okay, এটা হচ্ছে a importance of this testing, my friend. If you do the CBC test, see your erythrocyte count is low or your hemoglobin is low, PCV is low, MCSC low, then ଆମେ ଭାବିବୁ ଆପଣଙ୍କର ଆଇରନ୍ ଡେଫିସିଏନ୍ସି ଏନେମିଆ। ତ ଆଇରନ୍ କୁ ଆମେ ଠିକ କରିବୁ, ରାଇଟ୍? ଆପଣଙ୍କର ଯଦି ହାଇପୋଥାଇରଏଡିଜମ ଥିବ, ସପୋଜ ଥାଇରଏଡ ପ୍ରୋବ୍ଲେମ ଥିବ ଆପଣଙ୍କର, so according to that we'll try change the diet also. ବୁଝିପାରିଲେ? Yeah, so this is why my program is the best program, okay? Because as this is a personalized program, my friends. I know personalized program in the sense D3, yes, vitamin D3 ସେଥିରେ ପଳେଇ ଆସିବ। Yeah. So that thing will come in that see HSCRP ପଳେଇ ଆସିବ ଆପଣ। HSCRP ଯେ cardiovascular risk, ଯୋଉମାନଙ୍କର HSCRP ବେଶୀ ଥାଏ ହାର୍ଟ ଡିଜିଜ ହେବାର ଫ୍ୟୁଚରରେ ଚାନ୍ସେସ୍ ଥାଏ ତାଙ୍କର। ସୋ ଆମେ ତାକୁ ବି ଆମ ପ୍ରୋଗ୍ରାମରେ ଟେଷ୍ଟିଂ କରିଥାଉ ଆପଣଙ୍କର କମ୍ପ୍ଲିକେସନକୁ ଜାଣିବା ପାଇଁ। କିଡନୀ କମ୍ପ୍ଲିକେସନ ଜାଣିବା ପାଇଁ ମାଇକ୍ରୋଆଲବୁମିନ ଟେଷ୍ଟ କରିଥାଉ। ଓକେ, ଆମେ ଆଉ ଗୋଟେ ଜିନିଷ ଆପଣଙ୍କର liver complication ଜାଣିବା ପାଇଁ LFT profile ପଳେଇ ଆସିବ, liver profile test ପଳେଇ ଆସିବ, So all these things, see, this is the liver profile test to know the, globulin is 3.6, all these things, globulin, SGOT, SGPT will come. Why we do this kind of test, my friend? ମୁଁ ବାରମ୍ବାର ଆପଣଙ୍କୁ କହୁଛି what we measure that will improve. What we measure, just write in your notes. ଏମିତି ଗାଲରେ ହାତ ଦେଇକି ବସିଲେ କିଛି ହବନି ଜୟପ୍ରକାଶ ସାର୍, ଆପଣ ଲେଖନ୍ତୁ ନୋଟ୍ସ, ବୁଝିପାରିଲେ କି ନାହିଁ? just try write the notes in your notes କି what you measure that will improve. Okay, so where I am telling these things to you, just this is the number you can save also for the testing. Those who want testing, they can save this number. Take a screenshot of this number also. Take a screenshot of this number and you ask for the direct advanced test also. Okay, don't. चलो, so आमे जोड़े डिस्कस करथिले बीटा सेल आपन को पैनक्रियास केते काम करछि परसेंटेज जानिबा पई एंड ऑल दिस थिंग. सो बीटा सेल रो काम केते अछि जानिबा पई टेस्ट करा जाय. ओके, चलो देन आमे पळे जिबा आपनकर किछि पैनक्रियाटाइटिस हेछि कि एंड ऑल दिस थिंग. सो एटा तो एडवांस जिंस, बट आपनकर हाउ इंसुलिन एक्ट बेले बेले केस रे आमे देखु टाइप 2 डायबिटीज केस रे इंसुलिन काम कर न थाए. सो आपनको रेजिस्टेंस अछि कि यस और नो? तो रेजिस्टेंस माने कोन? सेंसिटिविटी रो जस्ट अपोजिट वर्ड. ओके, जदि आपनको रेजिस्टेंस केस थिबो ताले सेंसिटिविटी कमी जाइथिबो आपनको. For test outside Odisha, it is available. For test outside Odisha, you can do in the Thyrocare, no problem, madam. And we have a similar package in the Thyrocare also. You can do that test in Thyrocare also. I'll show that test package to you, no need to worry. If you want outside Odisha, you save this number. In Thyrocare, anywhere outside Odisha in India, you can save this number. And this is the number for outside Odisha, madam. Yeah, you can save 9023 317 317. This is for outside Odisha or Thyrocare browser आपण करि परिबे. You can save the number 9023 317 317. This is a test package in Thyrocare also, but he'll give you 99 package test. You tell the direct advanced package. Okay, you tell the direct advanced package test. Just take a screenshot of this page. Okay, yeah. Chalo. Then we jump to this is the things. Types of diabetes, आपण समझते जानी चंदी. Types of diabetes, type 1 is equal to particularly छोटो पिला मानन को जोटा हेई थे, पतला देखियो बहुत पतला देखा जानती. Type 2 diabetes जोटा बड़ो लोक मानन को हेई थे, mostly more than 70% case रे this type 2 diabetes. ଆଉ ଗୋଟେ ପ୍ରକାର ଅଛି, this is called gestational diabetes mellitus, जोटा कि pregnant महिला मानन को हेई थे. So upon types of diabetes lekhi rakhantu. Just write the type of diabetes. Okay. Just write the types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes. Okay. Just type. Why I am telling these things? कि आपण निजरो को type of diabetes आपण भी जानि परिबे. तार example दउछि आपण को. जदि type 1 diabetes हेतिबो छोट पिला मानन को हेई थाए, जोथरे आपणक इंसुलिन प्रोडक्शन कमी जाए. ओके, जोटा टाइप 2 डायबिटीज आपण सेथिरे देखिबे इंसुलिन सेंसिटिविटी कमी जिवो. आपण माने कोन? इंसुलिन थिबो किंतु काम कर नथिबो. बुझी पारले? सपोज मु एबे जो आपण को एग्जांपल देखेली, सपोज जदि गोटे टाइप 1 केस रे सी पेप्टाइड पूरा कमी जाए. हाउ टू डिफरेंशिएट टाइप 1 एंड टाइप 2? टाइप 1 डायबिटीज आपण देखंतु छोटो पिला मानन को हेता, छोटो पिला मानन. बट टाइप 2 डायबिटीज बड़ लोक मान को ही थे प्राय. ओके, छोट पिला माने जो माने आइसक्रीम्स, कोल्ड ड्रिंक्स एंड ऑल दिस थिंग बेसी खाउथंती. छोट पिला माने द जंक फूड, आइसक्रीम्स, कोल्ड ड्रिंक्स, कुरकुरे एंड ऑल दिस थिंग जंक फूड जो माने बेसी खांती. समटाइम्स वायरल इन्फेक्शन हे जाय, तांकर ऑटो इम्यून डिजीज हे जाय. एंड सेथरे कोन होय, आपण बिलीव करी मु जहां भी टाइप 1 केस देखुची, तांकर जदि हिस्ट्री नउसी, तांकर बापा मा पिला को नै के आछंती. मु पचारले माने कोता पिला जस्ट डायबिटीज हेबा आगर कोन खाउतला. दे आर ऑल गिविंग टिपिकल हिस्ट्री. मिल्क प्रोडक्ट्स खाउतला बहुत, चॉकलेट खाउतला बहुत, आइसक्रीम खाउतला, कोल्ड ड्रिंक्स पिउतला, एंड दिस कुरकुरी मुरकुरी ऑल दिस सुगरी फूड खाउतला. एवं जेते बेले आमे तांकर टेस्टिंग करू, से पचारला परे भी सी पेप्टाइड लेवल less than 0.01. This is called type 1 diabetes. जदि सी पेप्टाइड गुडे टेस्टिंग करू, आमे हमर प्रोफाइल टेस्टिंग रे पळे आसीबो सेटा सी पेप्टाइड टेस्टिंग. या इन दिस केस गुडे केस एग्जांपल मु आपन को देखौची. जो थे आपण देखिए सी पेप्टाइड गोटे टेस्ट लिखि रखु one test to differentiate type 1 type 2, this is called C peptide test and this HOMA-IR test. Okay, so in this case ମୁଁ ଯୋଟା ଆପଣଙ୍କୁ ଦେଖଉଛି this is a HOMA-IR report. ଆପଣ ଦେଖନ୍ତୁ insulin sensitivity 43%, ମାନେ କଣ resistance around 56%, so it is called type 2 diabetes. Okay, but beta cell function ଅଛି 82%, ମାନେ କଣ କାମ କରୁଛି beta cell ବି but fully function କରି ପାରୁନି, so it is called typical type 2 diabetes. Okay, but in this case କଣ ହେଇଥାନ୍ତା ଯଦି type 1 diabetes ହେଇଥାନ୍ତା ତା କେସରେ beta cell functions ଟା 0 ହେଇଥାନ୍ତା 0%, yes, but sensitivity 100% ଉପରେ ହେଇଥାନ୍ତା in case of type 1 diabetes. ଆଉ ଗୋଟେ ପ୍ରକାର diabetes sometimes called double diabetes. Okay, जो टाइप 1 डायबिटीज पेशेंट माने इंसुलिन नौथांती बहुत दिन धरी कि ताको डबल डायबिटीज होता है, टाइप 1 plus type 2 both. That's called double diabetes. I have seen that. Okay, okay, and this is the C peptide serum. You can see the C peptide report where I do this test because C peptide jodi 4 achi, that means it is type 2. It assess the pancreatic beta cell function. ଆପଣଙ୍କ pancreas ର beta cell କେତେ percent କାମ କରୁଛି ସେଟା ସେ ଦେଖେଇଥାଏ. It distinguishes between type 1 and type 2. Okay. Sasikant Panda, you please stop the screen sharing. Okay, you please stop this thing. Okay, yeah. Chalo. So this kind of things happen, you know. So you can see this is a type 1, type 2 differentiating feature mu apanku dekheli. But remember my friends, all maximum cases these are type 2 diabetes. Facts. I am just showing you facts. In type 2 diabetes, 90 to 95% people, those who have overweight, insulin sensitivity is less than 50%. Okay. And type 1 diabetes छोट पिला माननको ही था जो माने insulin नौथांती and but type 2 diabetes रे common symptoms देखिए आपण मोटापा थिबो, पेट बाहरी थिबो, पेट बाहरी की बारंबार परिश्रा होतबो, बारंबार भोक होतबो, आपणकर this kind of symptom numbness, unexplained weight loss बेले ही जाए, slow healing of the wounds, constant hunger, all these are the symptoms. Okay, these are the symptoms of typical type 2 diabetes, my friends. Okay, sometimes other types is called LADA, latent adult onset diabetes mellitus. Type 1 diabetes in adult is called LADA. So এই কেস রে भी যদি ଦେଖିବେ ଆପଣଙ୍କ C peptide low ଥିବ, ଲୋକ ପତଲା ଥାନ୍ତି, ବହୁତ ପତଲୁ ମାନେ ବହୁତ ପତଲା ଥାନ୍ତି ସେମାନେ, and GAD65 antibody positive ଥାଏ ସେଇ କେସ ରେ. Another type is called FCPT, जोड़ा कि फाइब्रो कैलकुलस पैनक्रियोपैथी, जोड़ा जो माने अल्कोहलिक थांती सेमानक केस रे देखा देथे, मैक्सिमम केस रे मद जो माने पिउ थांती, and sometimes also to some because of some infections कौन हुए कि आपनक पैनक्रियास रे स्टोन ही जाए. Just showing the image of that pancreas रे स्टोन ही जाए, right? So that stone creates the problem. Okay, and these are the different risk factors in diabetes. आपण मानको just basic जिन समूह देखे दोची. These are the major kind of NCDs, NRNCDs and all these things. So obesity kuhantu, diabetes kuhantu, cardiovascular disease kuhantu, hypertension, strokes. 90% of people dying due to this disease now. 90% people dying because of this disease now, right? ଏବଂ ସେଥିପାଇଁ ତାକୁ risk factor ଜାଣିବା ପାଇଁ ଆମେ କଣ କରୁ, ଆପଣଙ୍କ କିଛି symptoms କୁ ନେଇଥାଉ, ଆପଣଙ୍କର କଣ problems ହଉଛି basic some measurements ନେଇଥାଉ, some testing କରିଥାଉ, and sometimes also we install some CGM. See, these are some signs of diabetes. Okay, you can also type that. You can also know this thing. Acrocodons. अब भातुड़ी जदि आपनको बाहरी छी ना एबेटु सतर्क ही जानतु. आपण just check your nape of the necks. Just check your nape of the necks. आपण निजे चेक करंतु जदि एमतिया साइन अछि आपणकर एक्रोकोडोन्स अछि, रोजासिया एकिनी बाहरुची बारंबार, हाका तळे ब्लैकिश पैचेस अछि, भातुड़ी बाहरी छी आपणकर, and these are the blackish patches in the face. So understand friends, this is you are going to develop the diabetes very soon. Okay, these are the some signs, these are the symptoms of diabetes. Yes. You can also type your symptoms in the chat box. ଆପଣଙ୍କ କୋଉ problems ଅଛି ଆପଣ just type in the chat box below. I just want to check that. ଆପଣଙ୍କ symptoms କଣ ଅଛି just type in the chat box below. I just want to check your symptoms. Okay, friends? Yeah. So these are the signs of insulin resistance, friends, and that causes problem. This is the diagnostic criteria of diabetes. Okay. ମୁଁ ଯେମିତି କହିଲି ଆପଣଙ୍କୁ HbA1c ଯଦି 6.5 above ଥିବ it is called diabetes. Fasting blood sugar ଯଦି more than 126 ରହିବ this is called diabetes. Plasma glucose after 2 hour ppbs is more than 200 it's called diabetes. Yes. Whole year pimples on skin. Yes. This is a typical sign of insulin resistance. Deepak Samantray Babu. Yeah. So many people, this kind of signs, symptoms, you should aware of all these things. Okay, you should aware of all these things. That's why we do this kind of testing, my friends. Yeah. That's why we do this kind of testing to know your current status of diabetes. ଆପଣ ଲୋକ ମିଷ୍ଟେକ୍ କଣ କରନ୍ତି only fasting sugar କିମ୍ବା PPBS sugar testing କରିବେ and they are not doing any testing and they are continuing their medicine 1, 2, 3, 4, 5 like that and that causes problem. Okay, so ଆମର programs ରେ ଆମେ କଣ କରୁ ବେସିକ୍ ପ୍ରୋଫାଇଲ ଟେଷ୍ଟିଂ କରୁ ଯୋଉଥିରେ କି ଆପଣଙ୍କର କମ୍ପ୍ଲିକେସନ ଜଣା ପଡିଯିବ କଣ ପାଇଁ ଡାଇବେଟିସ୍ ହେଇଛି ଏବଂ ଆପଣଙ୍କର କିଛି କମ୍ପ୍ଲିକେସନ ହେଲାଣି କି ତାପରେ ଆମେ ଆପଣଙ୍କ ବେସିକ୍ ଆଡଭାନ୍ସ କୁ ଯାଇଥାଉ ଆମ ପ୍ରୋଗ୍ରାମ୍ସ ରେ ଠିକ ଅଛି because this HbA1c is a very gold standard test 3 monthly ଯୋଉଟା କରାଯାଏ and you can see our results so many patients those who reverse they have a very normal yeah. Some doctors diagnose as follicularity. What is the cause of follicularity? It's because of sugar, right? It's because of sugary food. Okay? Because diabetes is so many complications. Follicularity is one of the complications of diabetes. Okay? Because when sugar level is high, that causes infection, that causes inflammation, that causes bacteria to grow in your body. Yes, that causes bacteria to grow in your body. Okay? And that causes folliculitis and infection. Okay. And this is one of the main tests, right? Fasting insulin level. Fasting insulin level. Anybody have done this test, you can check that. Ideal, it should be less than 4. But nobody are doing this test. Normal less than 6. Okay. Borderline 6 to 10. Can just take a screenshot of this thing also, my friend. Because people are missing this golden test. That's why they cannot know their cause. Okay. Fasting insulin is the single most important predictor of development of type 2 diabetes. Okay. So how to measure insulin resistance? ଗୋଟେ ଆଉ ଗୋଟେ ଟେଷ୍ଟ ଅଛି ଇଟ ଇଜ ଡିଫିକଲ୍ଟ ହେଇଯିବ ଆପଣଙ୍କୁ ହୋମା ଏୟାର ଆମେ କାଢିଥାଉ ଯୋଉଟା ଆପଣଙ୍କୁ ଦେଖଉଥିଲି and insulin resistance is the main cause of all this thing. ଏବେ ଯୋଉ ରିପୋର୍ଟ ଆପଣଙ୍କୁ ମୁଁ ଶୋ କରୁଥିଲି particularly insulin resistance case ଟା ଯୋଉଟା so that will show you how much you are resistance now. In my programs I show that things to you. Okay, just ଆପଣ ଜାଣିଥାନ୍ତୁ ଯେହେତୁ ଡିପ୍ କୁ ଯାଉଛନ୍ତି ଆପଣ ବେସିକ ଜିନିଷ ଶିଖିବେ ଦେନ୍ ଆପଣ ରିଭର୍ସାଲ ଟା ଆପଣଙ୍କ ପାଇଁ ଇଜି ହେଇପାରିବ ରାଇଟ୍ ହୋମା ଆଇଆର ଟେଷ୍ଟ ଯଦି ଦେଖିବେ ମୋର ଦେନ୍ 2 ଯଦି ଅଛି ଇଟ୍ସ କଲ୍ ରେଜିଷ୍ଟାଣ୍ଟ କେସ୍ ଓକେ ସେଇ କେସରେ ଆପଣ ଦେଖିବେ ଟିପିକାଲ ସାଇନ୍ସ ସିମ୍ପଟମ ମୁଁ ଯୋଉଟା କହିଲି ଆପଣଙ୍କୁ because this high amount of insulin causes all this disease stroke heart disease gout atherosclerosis and all these things my friends so that's why in my programs I do that test also so I hope ki apan mane basic jinsa bujhigale so always don't think ki medicine is best for me because medicine sometimes has side effect one of my mentor told uh yeah pills thrill but could kill you also don't take a pill unnecessarily unnecessary pills ନେଇକି ଆପଣ ଲାଇଫ କୁ ବର୍ବାଦ କରନ୍ତୁନି what doctors don't get to study in medical school you know I am also writing one book now what doctors don't know about diabetes reversal in medical school Okay, my book will publish very soon. Okay, and today's final word is that ki, yeah, your knowledge is your power, your best security, and gain it to beat the diabetes forever. ମନେ ରଖନ୍ତୁ ଆପଣଙ୍କ जब तक knowledge ଟିକେ ହବନି ନା ଆପଣଙ୍କୁ କେହି ଡାଇବେଟିସ ରକ୍ଷା କରିପାରିବେନି ବୁଝିହେଲା ସେଥିପାଇଁ ଡାଇବେଟିସ ରେ ଗୋଟେ ଜିନିଷ ଦ୍ୟାଟ୍ ଇଜ କଲ୍ଡ ନଲେଜ ହିଁ ଆପଣଙ୍କୁ ଡାଇବେଟିସ ରୁ ପ୍ରୋଟେକ୍ଟ କରିପାରିବ ଏବଂ ମୁଁ ସବୁବେଳେ ଡାଇବେଟିସ କୁ ରାଇଟ୍ ଏଜୁକେସନ ପ୍ରିଭେଣ୍ଟ ଡାଇବେଟିସ କମ୍ପ୍ଲିକେସନ ଲେଖିକି ରଖନ୍ତୁ ରାଇଟ୍ ଏଜୁକେସନ can prevent your diabetes complication. But no people are interested on this thing, right, friend? So this is the basic task of today. You know, basic task in the sense ki first task is, yeah, save this number. My number is this much, and just WhatsApp me your name is with problems and any reports to my number. This is the day one task to you all of friends. Okay, this is the day one task. Save my number first. Yes. And please do it right now. ଏବେ ଆପଣ କରିଦିଅନ୍ତୁ କାମ କଟିଯିବ ଆପଣ ଲାଇନ ରେ ଅଛନ୍ତି ଏବେ କରିଦିଅନ୍ତୁ ଆଜିର ଟାସ୍କ କଟିଯିବ ଯେଉଁମାନେ ଦେଖିନଥିବେ ସେମାନେ ପୁଣି ଆଉ ଥରେ କରିବେ ମୋ ନମ୍ବରକୁ ଆପଣ ସେଭ୍ କରିଦିଅନ୍ତୁ ଆପଣଙ୍କର ନେମ୍ ଏଜ୍ ୱେଟ୍ ପ୍ରୋବ୍ଲେମ୍ସ ଆଣ୍ଡ ଅଲ୍ ଦିସ୍ ଥିଙ୍ଗ ଆପଣ ମୋତେ ହ୍ୱାଟ୍ସଆପ୍ କରିଦିଅନ୍ତୁ କାରଣ ଆପଣଙ୍କ ରିଭର୍ସାଲ ଷ୍ଟାଟସ୍ ଜାଣିବା ପାଇଁ ଏତିକି ଜିନିଷ ମୋତେ ନିହାତି ଜରୁରୀ ତାପରେ ପ୍ରୋଫାଇଲ ଟେଷ୍ଟିଂ ବିଷୟରେ ମୁଁ କହିବି ଆପଣଙ୍କୁ ଯୋଉ ପ୍ରୋଫାଇଲ ଟେଷ୍ଟିଂ ର ଯୋଉ ଜିନିଷ ଦେଇଛି ମୁଁ ଆପଣଙ୍କୁ ବିକଜ ପ୍ରୋଫାଇଲ ଟେଷ୍ଟିଂ ରେ ଏଥିପାଇଁ ମୋତେ ହେଲ୍ପଫୁଲ କରିଥାଏ କି ମୁଁ ଭିତରିଆ ଜିନିଷ ଜାଣିପାରେ ସେଥିରେ ଆଉ କଣ ପ୍ରୋବ୍ଲେମ୍ସ ଅଛି ଆଉ କିଛି କମ୍ପ୍ଲିକେସନ ଅଛି କି everything I able to know from that thing also. Okay, friends? Yeah. So please say that. Those who done this thing, just done in the chat box. Just type done. ଯେଉଁମାନେ ମୋତେ ହ୍ୱାଟ୍ସଆପ୍ କରିଦେଲେ ଏତିକି ଜିନିଷ ଜଷ୍ଟ ଟାଇପ୍ ଡନ୍ ଇନ୍ ଦ ଚାଟ୍ ବକ୍ସ ଏବଂ ଯେଉଁମାନେ ରେକର୍ଡିଂସ୍ ବି ଦେଖୁଥିବେ ଭିଡିଓର ଆଣ୍ଡ ସେମାନେ ବି ଚାହିଁବେ କରିବା ପାଇଁ ଦେନ୍ ଦେ କ୍ୟାନ୍ ଅଲସୋ ଡୁ ଦ୍ୟାଟ୍ ଓକେ ଆଣ୍ଡ ସେକେଣ୍ଡ ଟାସ୍କ ମୁଁ ଆପଣଙ୍କୁ ଦଉଛି ଫ୍ରେଣ୍ଡସ୍ those who posted the task to my number just type posted in the chat box okay just type posted in the chat box okay these are tasks of day one okay just to know your reversal status, just post these things to me. Okay. Yes. Because I'm just posting this task in the group also. It's the day one task for all of you. Okay. I have posted in that group also. Gola. Then second, what kind of test to done? Okay. Second task is that is the profile testing things, right? Yeah. Profile testing. If you want that, I also if you do this testing profile जो हम कहते आपको ଆପଣ ଯଦି ପାରୁଛନ୍ତି do that profile test is a very important things to understand basic thing this is the basic profile test ଯୋଉଟା ଆପଣ କରିପାରିବେ and this is also sharing the number in for outside Odisha this number okay I am sharing in the 3 days group okay another thing ଯୋଉଟା ମୁଁ ଆପଣଙ୍କୁ share କରିବି କହୁଥିଲି କି that number okay that number of sharing okay just a minute ଯୋଉମାନେ ଭୁବନେଶ୍ୱର ପାଖାପାଖି ଏରିଆରେ ରହୁଛନ୍ତି for testing they can save this number for testing okay yes ଭୁବନେଶ୍ୱର ପାଖାପାଖି ଏରିଆରେ ଯୋଉମାନେ ରହୁଛନ୍ତି they can do the testing also and I also share that things to you also friends okay testing number ମୁଁ ଆପଣଙ୍କୁ add କରିଦଉଛି call to testing number okay testing number is 7894406 ଆପଣ ଟେଷ୍ଟିଂ କରିଦେବେ ଦେନ୍ ଆପଣଙ୍କ ପ୍ରୋଫାଇଲ ରେଡି ହେଇଯିବ according to the profile ଆମେ କଣ କରୁ ଆପଣଙ୍କ ଡାଏଟ୍ କୁ ଡିଜାଇନ କରିଥାଉ my friends yes because profile ରୁ ବହୁତ କିଛି ଜିନିଷ ଜଣା ପଡିଯାଏ And according to that result, we'll also guide you, friends. So this is for day one tax. And in the day two, I'm going to discuss kariba diets in diabetes, root cause of diabetes, then diets को हमें जीवा root cause को जीवा एबे हमें बेसिक डिस्कस कले डायबिटीज कोन केते प्रकार रो कोन साइन सिम्पटम्स कोन टेस्टिंग करिया कथा फर्स्ट डे कला फर्स्ट डे परे हमें सेकंड डे रे डिस्कस करिबा आपनकर को रूट कॉज कोन what are the protocols of reversal and diets in diabetes. Okay, so thank you so much, and if you have any questions you can just Bipin Pati, just post in the WhatsApp, not in the chat box of Zoom. Just post in the WhatsApp. This is the day one task I am told you. Just post to my number. Okay, you can just one second day discussion will be tomorrow 9 p.m. to 10 p.m. Okay. So ଆପଣ ପ୍ରଥମେ ଦେଖିବେ ଭିଡିଓ କିଛି ଡାଉଟ୍ ହେଲେ ଆପଣ ପଚାରିବେ ଓକେ so thank you so much for day one and please post your task first thing second thing call to the testing number book your slot for testing ଆପଣ testing କଲା ପରେ ଆପଣଙ୍କ profile report ready ହେଇଯିବ then your one to one consultation ସେ ଭିତରେ ଆପଣଙ୍କର ଅଲଗା ଅଲଗା ଜିନିଷ ଯାହା ବି ଅଛି ଯେମିତି କି ଆପଣଙ୍କ diets and all this thing ର knowledge ଆପଣ ନଉଥିବେ ତାକୁ ଦେଖିକି ଆମେ କଣ କରୁ ଆପଣଙ୍କ ମେଡିସିନ୍ସ କୁ ଟେପରିଂ କରିବାରେ ଆମକୁ ଇଜି होता है posted thank you so much Sachit Parma ji okay thanks a lot okay other people please just post to my number and just type posted in the chat box okay this is for day one class I hope you have gained some knowledge okay some knowledge जोटा कि आपण आगरू पाई नथिले yes or no okay thanks a lot Umesh Babu thanks sir okay Deepak Samantara, thanks a lot you so much. It's a convincing, boosting our mentally. Thanks a lot because ଆପଣଙ୍କୁ ମୁଁ ଏକ୍ଜାମ୍ପଲ ଦେଖେଇଲି ସେଥିପାଇଁ କି କୋଉମାନେ ରିଭର୍ସ କରିପାରିଛନ୍ତି ରିଭର୍ସାଲ actually because I have researched a lot of things my friends I have researched a lot of things and so you can see to my cupboards these are all my books of reversal and you can see some of my other books from this side also and these are my yeah food the medicines and all lies my doctor told diabetes code blood sugar solution so many other books of reversal are there but yes I am just showing some books to you so that you have some basic knowledge on this thing also okay so that ଆପଣ କଣ ହବ କି ଓଡ଼ିଶାରେ first time we are conducting this kind of programs where thousands of patients coming they are reversing and we have also sometimes we conduct camp program you just go to my YouTube channel also you can see a lot of video there right and in that video yeah ଦେଖନ୍ତୁ ଏଇଟା ଜଣଙ୍କର testing report so that we can benefit କଣ ମତେ ହୁଏ कि ମୁଁ ସବୁ ଜିନିଷ ଜାଣି ଏପୋ ଲିପୋପ୍ରୋଟିନ୍ ଜାଣିଦେବି everything I know about your reversal status what can be done in the next step right chalo this is for the things and this is my YouTube channel's link I am just sharing the link in the chat box or you can search in the Google box Google you can type that Dr. Madhab diabetes Dr. Madhab diabetes DIABETE diabetes reversal PRS ଆପଣ ସେତିକି ମାରିଦେଲେ ନା YouTube ପଳେଇ ଆସିବ so many video you can see in my channels right okay just showing you the link another tax is that you please share these videos to others okay please share this video to others so that people can know this thing okay they have no knowledge on reversal okay this is my channel link okay this is my channel link you just go to the playlist you can see all these success stories and see their response ଆମର camp numbers everything ଆପଣ ପାଇପାରିବେ I also conducted some physical camps also I also conducted some physical camps and otherwise I also conducted this online camps also online programs also because ଯେହେତୁ ଆମ camps ପାଇଁ seat ନଥାଏ ଆମେ online programs ବି ଆପଣଙ୍କ ପାଇଁ କରିଥାଉ friends okay so no need to worry so much about that those who got for camp have already filled up so ଆମେ online program ବି କରିଥାଉ ଆପଣଙ୍କ ପାଇଁ no need to worry for that even online ରେ ବି so many people have stopped their insulin and medicines you can listen to them also because ଆପଣ ଏଟା ନିଜେ ଶୁଣିବେ ମୁଁ ଖାଲି ଆପଣଙ୍କୁ link ପଠେଇ ଦେଇଛି and you can listen that any other questions from the day one you can just ask in the chat box okay so I try to clear your questions okay just and type your question in the chat box. Day one. Okay. Go to the chat box. Just type your questions. Okay. Then I'll talk with you all tomorrow. Physically, where you can meet if you sir, Deepak sir. You can meet me physically in my camps also. Now, upcoming camp is 23rd. Okay, so thank you so much for listening that. Ki I want to meet you physically somewhere how to possible Subhasis but next sir କହୁଛନ୍ତି sir ଏବେ ଆମର କ୍ୟାମ୍ପସ୍ ଅଛି in ଭୁବନେଶ୍ୱର from 17 ତାରିଖରୁ ଅଛି up to 17th up to ଅଛି ଆମର 21 17 18 19 20 this 24th yeah ଏଇ ଅକ୍ଟୋବରରେ ଅଛି 17 ଏବଂ 24th ରେ ଅଛି ବ୍ରହ୍ମପୁରରେ so 17 ରୁ ଅଛି and if you need for the camp ପାଇଁ details ଆପଣ number note କରନ୍ତୁ you can call to that number just sharing the number in the chat box okay 9090 171 591 9090 171 এটা କ୍ୟାମ୍ପସ୍ ନମ୍ବର ବଟ୍ ଆମର ପ୍ଲାନ୍ ଥାଏ ଆମେ ଇଭିନ୍ ଅନଲାଇନରେ ବି ଲୋକଙ୍କୁ କାଉନସିଲିଂ କରିଥାଉ ରିଭର୍ସାଲ ପ୍ରୋଟୋକଲ ବତେଇଥାଉ ଆପଣମାନଙ୍କୁ ଯଦି ଆପଣଙ୍କ ଟାଇମ୍ ହଉନି ଦେନ୍ ୟୁ କ୍ୟାନ୍ ଅଲସୋ ଯଦି ୟୁ ହାଭ୍ ଟାଇମ୍ ଆମର ପ୍ରାକ୍ଟିକାଲ ଜିନିଷ ଶିଖିବା ପାଇଁ ଚାହୁଁଛନ୍ତି ଆପଣ କ୍ୟାମ୍ପ ବି ଆସିପାରିବେ ଠିକ ଅଛି ଏବେ 17 ତାରିଖ ଅଛି ଏଇ ଭୁବନେଶ୍ୱରରେ ଠିକ ଅଛି ସୋ ୟୁ କ୍ୟାନ୍ କମ୍ ଦ୍ୟାଟ୍ ଓକେ ଆଣ୍ଡ ଫର୍ଦର ପାଇଁ ଆମର ଟିମ୍ ନମ୍ବର୍ସ ଆମର ମଲ୍ଟିପୁଲ ଭିଡିଓସ୍ ଅଛି ଆମ ଚ୍ୟାନେଲ୍ସରେ ଆପଣ ତାକୁ ଦେଖିକି ବି ଆପଣ ଜାଣିପାରିବେ ଠିକ ଅଛି ଏନି ଅଦର ଡାଉଟ୍ସ ପ୍ଲିଜ ଆସ୍କ ଇନ୍ ଦ ଚାଟ୍ ବକ୍ସ କାଲି ଆମର ଡେ 2 ରେ ଆମେ ଡାଏଟ୍ ବିଷୟରେ ଚର୍ଚ୍ଚା କରିବା ପ୍ରଥମେ ଡାଇବେଟିସ୍ କ'ଣ ଡାଇବେଟିସ୍ ବିଷୟରେ ବେସିକ୍ ନଲେଜ ରିଭର୍ସାଲ କାହିଁକି ଜରୁରୀ ଅଟେ ତା ବିଷୟରେ ନଲେଜ ଆଣ୍ଡ ତାପରେ ଆମେ ଡାଏଟ୍କୁ ଯିବା ଠିକ ଅଛି କୁହନ୍ତୁ ଏନି ଅଦର ଡାଉଟ୍ସ नो डाउट्स ओके चलो थैंक यू सो मच एंड काली हमर डाइट विषय जो चर्चा अछि मोर छोटिया वीडियो पठेबी काली आपण टे देखिबे ताकू एंड देखला परे आउ नुआ नुआ जिंस विषय हम चर्चा करिबा सो ताकू भी आपण नॉलेज जानी परिबे सेतरे सो दैट रिवर्सल कोन एंड ऑल दिस थिंग विषय आज आपण टिके बेसिक बुझी गले हमें डीप डिस्कशन करिबा काली डाइट विषय चर्चा करिबा ओके सो थैंक यू सो मच आपण जो जो नंबर कहली से नोट कर दियंतु जो जो टास्क कहली आज ताकू टिके फिल अप कर दियंतु